Hi everyone, this is Lisa. I'm here with Mohammed Basil and Melanie, and we are just going to give you guys some updated information about COVID-19 that affects all of our staff here at RSP. So we're going to talk about updated COVID-19 information, about our PPE rules here at RSH, some HR updates regarding use of PPE, and also the quarantine sick leaves, how you can reduce your risk both in and out of work, and our new contact tracing process, including our communication pathway, and talk about what does quarantine and isolation mean. So what is COVID-19? COVID-19 is a coronavirus. It's a virus that causes a disease. It's a similar virus to the common cold, but COVID-19 is actually caused by a new coronavirus. Transmission occurs mainly through respiratory droplets, similar to the seasonal flu, and this means it can be spread when someone coughs, sneezes, talks, or even breathes. There's a couple differences with COVID-19 that make it a little bit unique. One is that the droplets can be smaller and lighter than normal, which means that they can stay airborne and infectious for longer times. So it's a little easier to spread than the flu. And also that people who do not have any symptoms may still be infected and infectious, meaning that they can spread it to others even if they don't have a fever and they don't have a cough. And this is really why our preventive measures, such as wearing a mask, maintaining a good distance from others, and frequent hand hygiene are really essential to preventing the transmission. And just as an update globally, there have been over 37 million confirmed cases of COVID-19 with over 1 million deaths. And there's no sign that the pandemic is slowing. And here in Jordan, it seems that cases are still rising. So we need to be really, really careful and cautious and make sure that we're doing everything we can to prevent transmission. So we'll talk a little bit about what are the symptoms of COVID-19. COVID-19 has many different symptoms. A lot of them are very general, and so it can be a little difficult to tell if it's COVID-19 related or if it might just be the flu, if it might be allergies. And so we all need to have a really high level of alert in watching out for these symptoms. So some of the symptoms of COVID-19 include fever, cough, general weakness or fatigue, headache, muscle aches, sore throat, runny nose or congestion, shortness of breath, difficulty breathing, loss of appetite, nausea, vomiting, diarrhea, confusion, and loss of smell and loss of taste. The difficulty with COVID-19 is that not everybody has all of these symptoms. Not everybody has severe symptoms. Some people may just have a sort of mild sore throat. And so it can be difficult, like I said, to tell if you actually have COVID-19 or something else. The two symptoms that do seem to be very specific to COVID-19 are the loss of smell and loss of taste. But otherwise, symptoms could be very, very mild. So we ask that everyone be aware of these symptoms and to be on the lookout for them in yourself and your family members. And if you have any question or think that you might have some symptoms or your family might have some symptoms of COVID-19, we just ask that you call the ma'am, Dr. Suhaib, to discuss.
Okay guys, so we'll move to the most important protection way, which is the masks. As you all know that COVID-19 is transmitted through the droplets coming out from the nose and mouth. So the first step to protect yourself and others actually is the masks. Here in RSH, we are categorized into two people. Some of the people are working with the patients and some of the people are administrative. So there are two types of masks, which is the cloth mask and the surgical mask. The cloth mask is actually could be used for the offices, could be used for the administrative staff who are not having a direct work with the patients or interaction. For the other staff who are having a direct contact with the patient, doing procedures, we should be wearing the surgical mask. You have to know that this mask should not be going down your nose or mouth all the time you are available in RSH, as well as these masks should be changed every 4 hours. So whenever you are in the hospital, you should be always wearing the mask, even if you are in the office alone. You should wear a mask anytime also you are within 2 meters of another person, even if you are outside. The other PPE we are having in RSH is the goggles. The goggles or the face shield are required for all patients' interactions done by all the clinical staff. So if you are doing procedures for the patient, including splashes of fluids, you have to be wearing the goggles to protect your eyes, because also the eyes are a source of getting the virus through the droplets. The other PPE we are having is the gown, the gloves, and the boots. These are used for highly infected procedures like suctioning, like cleaning for the hygiene agents. So it should be worn within your interaction with the patient, and for the boots as well, it's been used, we have to use it for the cleaners when they are cleaning the rooms.
Hello everyone. Okay, so regarding the importance of wearing the PPE and the mask in the hospital, we've been asking you for several weeks now to be wearing a mask to comply with those safety measures. With the gravity of the situation and the increase of numbers, both outside the hospital but also inside the hospital, it is now mandatory for every single person in the hospital to be wearing a mask when they are at work or surrounding the hospital. We are going to apply disciplinary procedures if someone is not complying with this. The infection control team will be going around the hospital if you have any questions, and to make sure that everybody is following the rules. We will not be accepting any excuses. So if you have doubt in exception that could be made for your situation, do wear the mask and come and talk with Mohammed, Basel, and Lisa, okay? And they will explain to you why or why not we have to continue with the rules or differ from it. But I hope everybody is understanding that this is for the protection of everyone, for you, for your colleagues, for our patients, and for your family members and people around you. Thank you for your understanding with this.
Okay, so it's very important to reduce the risk for yourself and for the staff around you. So how are we going to reduce the risk inside the hospital? As an infection prevention, the main and the most important method to protect the cross-contamination is a hand hygiene. And I'm sure that everybody knows how to wash our hands either with alcohol or with water and soap, with the minimum time and the proper techniques for hand hygiene. Again, the respiratory hygiene is very important. We shouldn't be coughing in front or at the face of anybody. We should be covering our nose and mouth when we cough by our elbow or by using the tissue and then discarding the tissue in the dustbin and then washing your hands. Always your PPE should be worn on, and it's not only my job as an infection prevention, it's everybody's business. You have to remind your colleagues whenever they are not wearing or using the proper PPE, just to have a collaborative work for preventing the infection among the hospital. Avoid direct contact with others. Please do not touch, do not kiss, do not hug others, as this is a very important issue to prevent the cross-contamination among the staff. Avoid gathering for smoking, coffee breaks, please. We don't want to see so many people around the table getting their food together. If you want to have your smoke, you want to have your tea, whatever, you have to be almost away from the others, 2 meters if you really need to have somebody. Otherwise, try to stop this habit and smoke alone. Avoid visiting units other than where you are assigned to. If I have less work at my department. I don't have to be visiting all the hospital, just roaming around, because this is also a very important method or procedure to prevent the cross-contamination. If I have a positive signs and symptoms, as we have said before, please do not come to the hospital, inform your supervisor, and keep away from the others, just to protect yourself and the others. Keep at least 2 meter distance from the others, even outdoors. Outside the hospital, of course, hand hygiene, we will never say it's bad, because it's very important, and we have to do the hand hygiene every time we are touching surfaces, we are touching goods, we are touching anything, and doing a proper respiratory hygiene also outside. Minimize traveling, going to stores. If there is no need to go to clusters or accumulation of people, don't do that. Just try to go whenever you really need something to pick up from outside. And even when you are outside, try to keep your mask always on. Please try to monitor your family and yourself for any signs and symptoms of COVID-19, which we have mentioned before. Avoid gathering with neighbors, friends, family, and people living in another homes, and stay home. When you feel sick, please notify the medical activity manager, you or anybody in your family, just to make sure that you haven't got the infection. Thank you.
And so now we're going to talk about contacts and contact tracing. So the first thing is, what is a contact? There's been a lot of discussion about, am I a contact, am I not a contact? So basically, WHO defines a COVID-19 contact as any person involved in any of the following interactions with either a confirmed or a probable case of COVID-19. And so that's really important. It can be either someone who has had a positive PCR test, but you could also be a contact of someone even if they haven't had a positive PCR test. A probable case includes anyone with symptoms, basically. So if you've been in contact with a family member who may have some symptoms, you could still be a contact. And so that's why it's really important to let us know, to let Dr. Suhaib know, so that he can help you evaluate whether you're a contact or not. So basically, if you've had any of these interactions with either a confirmed or a probable case of COVID-19, you may be a contact. That includes a face-to-face interaction within 1 meter for longer than 15 minutes. It is important to note that while WHO uses the 1 meter distance, CDC uses anything within 2 meters as a contact. And so really, the more distance you put between yourself and others, the better. If you've had any direct physical contact, which includes even a brief handshake, a brief hug, a brief kiss, anything like that would be direct physical contact with a probable or confirmed case of COVID-19, you would also be identified as a contact. Also, if you've been providing direct care with a probable or confirmed case of COVID-19 without using proper PPE. So this is really, I think, the most important, is that if you are always using your PPE, you're maintaining your distance from your colleagues, from others, and you are not coming into direct physical contact, you are not a COVID-19 contact. So the most important thing is really to wear the mask, wear your PPE, and if you have any concern or question, go ahead and call Dr. Suhaib to get clarification. And that brings us to contact tracing. So basically, the goal of contact tracing is to identify anyone at RSH, either staff or patients, who may have been exposed to COVID-19, and then to take action to make sure that it doesn't spread further. So you as a staff member, if you think that you may have been a contact, or if you or your family are having symptoms of COVID-19, we ask that you go ahead and call call Dr. Suhaib, and he will go through with you to determine if it is possible COVID-19, or if you may be a contact. So once he gathers information from you, he will go ahead and confer with Dr. Rashid from Staff Health, and they will determine what the best course of action is. They'll let you know if you need to quarantine, if you're okay to return to work, if you need to have a PCR test done, and what other follow-up actions you need to take. Just to know that right now, if you are being requested to have a PCR test done, and that's been approved and authorized through Dr. Rashid and Dr. Suhaib, then MSF will cover the cost of that PCR test. If you are going to get a PCR test on your own without being told to do so by Dr. Rashid or Dr. Suhaib, MSF will not cover the cost of that test. So just for you all to be aware. Basically, if you are told to quarantine, Dr. Rashid will notify HR to determine the length of your quarantine, and HR will officially notify your line manager that you are going to be out for this many days. Just to note that all quarantine and isolation leave time will be recorded as sick leave by HR. And being placed on quarantine or being asked to quarantine will not affect your employment with MSF in any way. So you don't need to be afraid to let Dr. Suhaib know that you or your family may have COVID-19. This does not affect your employment. We really just want to make sure that you are safe and that all of our staff and patients here are safe. And then for managers, I know this has been an issue for the hygiene team. It's difficult when you have a lot of staff out on these long quarantine leaves for 1 or 2 weeks at a time. So if you are feeling in your department the impact of having a number of staff out at the same time, don't hesitate to contact Melanie and to contact HR. Because they can help you figure out how to cover those responsibilities and if there's anything else that can be done. And then I just want to talk a little bit about what is quarantine versus isolation. So right now we've started both a quarantine unit and an isolation unit at RSH. Quarantine is really to separate people who are asymptomatic. They don't have any symptoms, but they might have been exposed to an infectious agent or disease, in this case, COVID-19. So if you're identified as a COVID-19 contact, you may be asked to quarantine. And this is really to separate you during the incubation period, the time in which you might have the infection and you may be infectious. You might be able to transmit the infection, but you don't necessarily know. So this is really just to help prevent transmission. So if you're identified as a COVID-19 contact, you'll be asked to quarantine for a period of time at home. And Dr. Rashid for staff health will go ahead and follow up with you, ask about the development of any symptoms, any progression, if your family's having any symptoms, things like that. Just follow up, make sure that you're okay, and then let you know when you're safe to come out of quarantine and come back to work. Isolation is really used to separate people who are symptomatic or who have laboratory confirmed cases of COVID-19. So these are people who are very likely to be infectious. And so this is to help prevent the spread of the infection or contamination to anywhere else. So if you're symptomatic or you test positive for COVID-19, you may be asked to isolate. And Dr. Rashid and Dr. Suhaib will be able to help guide you on how to safely isolate from your family. Also to note that if you develop any sort of symptoms and you need medical treatment, MSF now has an agreement with Istiqlal Hospital to treat all of our staff and patients for any COVID-19 related issues. So MSF will be able to help you seek treatment if you do develop symptoms of COVID-19. And that was really all of our updates. Thank you all so much for listening. And if you have any questions at all, don't hesitate to ask Mohammed Basso, myself, Melanie, or Dr. Suhaib.